as I had already given you the preliminary report and comment from my side, today the doctors will give you a proper report. We will request the teachers, or will you do it?
Teachers can give a summary of this case.
Yes.
So you want to give a type report?
So this case, it was a case which was referred from Umden PHC. This case had gone to Umden in the morning time. She had gone in the morning time, and following that, she was kept under observation in Umden PHC for a few hours. Which after that, because she was having this mild blood stain discharge with around 5 weeks pregnancy. So, however, because she was not feeling, she wanted to go home, so she requested for a discharge on request, which we say, stating that she has a small child at home, she would like to go back home. So she went away with the husband, and she was discharged on request at around 5:50 p.m. But again, it so happened that on the same day at around 11:50 p.m., she came back with a history of pain, abdomen. And the pain was not that severe. She came walking by herself. So, the doctors had attended to her in the Umden PHC. And subsequently, they told her to go for a proper checkup and referred her to Civil Hospital Nongpur. And when because we have only one ambulance for the from the CMSMS scheme we have in Umden PHC. So those we keep for those urgent cases. She was not having active bleeding, the patient was stable, BP, everything, and not bleeding also, not much. So the staff from there, they rang up because we have tied up vehicles which provide free transport. We have 2 vehicles, tied up vehicles for CMSMS. So the one was not picking up, the other also he replied after maybe after an hour or so. And since he said that it's not an emergency case, he could not go. So however, the patient and the patient's relatives, the husband, they said that they would like to go that day only, and they were willingly, they said they'll take with their own private vehicle, and they took the patient to Nongpur. So once the patient reached Nongpur, she was examined by the doctors on duty, and what they found was that at around 2:55 a.m., and since she was diagnosed as at this point of time just as threatened abortion, and so she was sent back to the maternity ward for observation, and there was no active bleeding, the patient was stable. Then the next day, that was the night of the 21st. So the next day, night of 20th, no, the 21st. So the next day, the gynecologist also had examined the patient at around 9 a.m. and found that the patient was stable. He had given treatment and advised complete bed rest. So, the whole time from 9 till around evening time till 4, there was no other further complaints. But at around 4:30, she again complained of pain of abdomen, and so the staff had attended to her. They had contacted the doctor. That time the doctor was busy in the labor room. So she had gone to the labor room and asked him what we'll do. She's complaining of pain. So he said, as soon as I finish this case, I'll be coming. But for the meantime, give her some medication, because already she's been looked. The gynecologist had seen her in the morning, had written the list of advice what to do when she has any of the complications. So following that was around 6:45, around 6 after 6. She was again having the urge to attend the toilet. So the husband was accompanying her. They did not inform the nurse. Actually, she was supposed to be bed rest. And ideally, when we say complete bed rest for threatened abortion, even the we have to attend when they go for toilet, we have to give her a bedtime. So they did not inform the staff. So the husband, since she said that she wanted to go to the toilet, so he accompanied the wife to the toilet. And it so happened that as soon as she entered the toilet, she expelled spontaneously the baby, which is not a full term, only about 19 weeks, as per USG, which was done previously even before all these things happened. She had gone to a private hospital, and USG was done maybe 18th, if I'm not mistaken, and it was a 19-week, 5 days old fetus. So she had expelled spontaneously, and normally under normal circumstances also 0 or 5 months, we cannot, we cannot do any resuscitation. I mean, we cannot, the baby, unlike we